Welcome to your FRCS Orth Adult Pathology Viva with joint success. Shoulder arthritis. A 65-year-old man comes into your upper limb clinic complaining of right-sided shoulder pain for 2 years. He's struggling to wash his hair and physiotherapy hasn't helped. He's had an X-ray on arrival today. Here's his plain film image. Tell me what you can see. What 3 questions do you want to ask him? Which of his shoulder movements is most likely to be restricted? What treatment will you offer him next? The patient comes back to your clinic in a few months and he is still struggling with pain. He wants something doing. What operation will you offer them? What are the pros and cons of the different arthroplasty options in this scenario? What risk will you warn them of? How will you work them up for theatre? They have this investigation as part of their workup. Describe the image, classifying the abnormality if you are able to. What implications does this have for your operation? How will you prepare differently having seen this CT scan? So, what operation will you list him for? Tell me your rehabilitation protocol for this type of arthroplasty. Thank you, this station is over. Which question did you find hardest? Comment below to let us know. Here are some suggestions for how we think you should answer these Viva questions.
Subscribe for more content. Let us know what other Vivas you'd like to see.